Good evening and welcome to another episode of Hatching for Health with your host, Jessica Hatch. Tonight we are going to discuss hemophilia A. Now, hemophilia A is an inherited disorder that actually causes the blood to not clot due to insufficient clotting factors. We have a special little boy on tonight named Hank, along with his mother Amanda, who is going to share with us their story so we can learn a little bit more about this disorder. Welcome to the show, guys.
Hi.
Hello.
Well, don't you guys look great and festive on this Tuesday evening?
Thank you.
Yes.
We're happy to be here.
Yes, and I'm happy to learn from you guys. I know that from the research I've done with hemophilia, there's, an A and a B, and then there's some other various, components that I think you guys are going to be able to enlighten us with. But I just kind of wanted to start with understanding, when it was that Hank was diagnosed and at the age and exactly what was, the timeline in y'all's life at that moment.
So we have an older son as well who does not have hemophilia. So it's,
no trace of the gene.
And so, and we didn't have any family history of hemophilia. So it is an inherited disorder, but nobody in our family had that. So at 9 months, Hank was, one day he just stopped crawling and we didn't know why. And we took him to the emergency room and they did, full body x-ray and they did blood work. And then they told us to follow up at the pediatrician. And we did that. They thought that his elbow was broken.
So they just put a cast on it.
And
Yes,
this was at 9 months old? This is at 9 months
At
old?
9 months old.
9 months.
Okay.
Mm-hmm.
So he was actually like walking or crawling at that point? Is that what you're saying? And then Crawling, okay. And he had stopped crawling just kind of all of a sudden. And they were, so naturally as a parent, you went in and then they started to do multiple imaging tests and thought maybe it's a broken arm, broken leg or something. And then, and then continue from there?
Yeah, and so when they did an x-ray on his arm, they determined that they thought that his elbow had shifted a little bit, and that's why they put the cast on. But when the cast came off, he was still in a lot of pain, and what that x-ray was actually showing that they weren't reading correctly was blood. So he was bleeding in his elbow joint, and that's why he was in so much pain and why it was swollen. And they had also sent us to a hematologist in the meantime. And the same day that the cast came off, the hematologist called and said, your son has severe hemophilia A. He's having a joint bleed in his elbow, and we need you to come in so that he can get something called factor.
Okay, wow. So something called factor, and that I additionally saw that this is a disorder that, fortunate for you guys and other families with children with it, there is something that's, able to be taken to help, improve the child's life. It's not curable just yet. But is that what you're leading to, this particular medication that they can take?
Yes. So factor is something, it's like a replacement clotting factor for the one that he's missing. But it has to be administered intravenously. So at that age, kind of skipping 2 months ahead, when he was 11 months old, he was diagnosed with an inhibitor, which meant that the clotting factor, his body was rejecting the clotting factor.
And just eating it all up.
Yeah. And so he had to have a port placed, like how a cancer patient would normally have a port put in. He had a port placed, and so we had to give his medicine through the port, the factor through his port.
So what was going through your mind at this point with, you and your family? All of a sudden you're learning this about what you thought was perfectly healthy little boy. Kind of just tell me that emotion at that point in y'all's life.
It was a whirlwind for sure. We, our oldest son, he was not a great sleeper. And so we thought, this will be our easy baby. And then it turns out that
he has severe hemophilia A.
Yes. And so we had to learn a whole lot in a short amount of time. My husband and I both worked in the software business. My husband's a programmer, so we didn't know any medical knowledge at all. So when we were first told, we were like, so does he take a pill for this, or what do you do about this? And then they started explaining how the medication needed to be administered, and so we just went through the process of we had a home health nurse come to our house and teach us how to do everything step by step. My husband and I both learned, and we would take turns giving him his medicine. But yeah, it was for sure daunting. It was a lot to take on, and we just kind of went into a mode of just trying to figure out, we have to keep going, so we have to learn this.
Yeah, this is
because of the inhibitor, I had to get stuck with a needle in my port every single day from ages 1 to 3 or 4.
Yeah.
Really? Every single day for almost 4 years?
It didn't hurt that much when you got used to it. When you were 2, you would, if you were doing it since you were 1, at age 2, you would probably be definitely used to it.
And how long of course, how long did you have to, so the needle went into the port and then to basically administer the medicine, and so how long would you sit there and have to have that medicine? Was it a short time frame, or was it long?
30 minutes-ish.
The whole process probably took about 30 minutes. He's right.
Okay. So you do that for a period of years, once you are diagnosed with the disorder, and then you don't have to anymore? Or tell me, what changed at age 4 where you don't have to have that port?
So inhibitors happen to about a third of hemophilia patients. And so not everybody that has hemophilia gets a port, but because we had to give him medicine every single day, they had us have a port placed. And so we basically, when you have a port, you go on something called immune tolerance therapy, which is the daily dosing. And the idea is to dose him, with really large amounts
every single day,
so that his body gets used to it. Yeah.
Okay.
And then after and to answer your question, after age 4, I didn't just not take it. I just took it 4 times a week: Monday, Wednesday, Friday, Saturday.
Yeah.
Also through a port?
And I did that until age 7.
Okay.
Yeah. Yes. He kept his port until he was about 7. So when he outgrew it, the line just didn't reach, anymore because he had grown so much.
Okay.
Are you
There's
showing?
a little scar.
That's your scar.
Oh, I see.
It was right there.
Yeah.
Yeah. So when that came out, we had to start learning how to administer his medication through a vein. And so we had to start over with, learning how do you do that.
So did you go to nursing school? No, I'm kidding.
No.
But you were taught, what a nurse or maybe a medical assistant would need to learn to properly take care of your son and not have to run back and forth, for that medication, to be inserted each and every time. So I'm sure that made the most sense.
Yes.
So when he was diagnosed, because I'm assuming there's many different things that would lead a doctor to believe that this child does have hemophilia. He was very young, obviously, but is there certain things that families should look for, to know whether or not their child possibly has hemophilia?
I from what I understand, a lot when a baby's born and they do the heel stick in the hospital on day 1 or 2 or whenever that happens, a lot of families find out that way because it won't stop bleeding. We somehow made it through all of that, and
it appeared at age 9 months.
Well, you always had it.
But it first started showing symptoms at 9 months.
Yeah.
Not T plus 1 day.
Yeah, no. So I guess that there's a chance that that's going to take place the way that it did for you guys, where it's not identified at birth, and then at that point, You know, I mean, it's a very scary situation. I'm assuming being that, you know, like when the blood actually starts happening, it, you know, the clot doesn't naturally happen like other people's blood would work. Like that was, you know, part of the definition. It's like the insufficient clotting factors people with hemophilia do not have. So I guess, for example, like if y'all had not taken him in, was there a risk of actually, you know, something even more dramatic happening? Or what were they telling you when they said, okay, this is actually the diagnosis? Did they have, you know, any concerns if he had not been brought in?
Because it was his elbow, you know, that would just have been, he would have just been in extreme pain for a long time, because having blood throughout that area that you're not supposed to have it causes a lot of you know, pain. Really, he was screaming during that time.
Oh, wow.
But for example, if you were to have a head injury, you know, that requires, you know, immediate factor. We would not have been able to go for the 2 weeks, you know, that he had that cast on, you know, on his arm. That a head injury would be a completely different story.
Yeah, I would definitely agree. So is there a blood test that they can do on babies that you say, hey, I want to just, you know, check my child for hemophilia A or B, or is there not a way to test it? It's basically happens upon an incident of somebody, you know, bleeding. Because I know it's not just about external bleeding, it's also like his situation internal. Is there a blood test?
So they did test him for, it was called a PTT test. I don't know exactly what that stands for, but they said that he had an elevated PTT test. And that sent us to the hematologist, basically. And the hematologist ran more tests. But I would say between the time he was born and the time that he was diagnosed, he did have a lot more bruises than our older son, who doesn't have hemophilia. And we had no idea how he was getting them. You know, they were just really big bruises that we had no clue what was happening. So
I still get them, just not as often. I still get just big bruises coming out of nowhere, just not as often.
I see. Well, we're going to take a quick break, and when we come back, I want to talk more about your everyday life with school and all the different things that you maybe have to alter just due to the fact that you are living with this disorder. So we will come back shortly after the break. Hi, it's Jessica here with Infinity Diagnostics, located here in the heart of Houston. Follow me in, I'm going to show you our MRI machine. We have a 1.5 Tesla Siemens magnet. We're able to perform imaging on your spine and multiple other areas. So please come give us a visit for all of your MRI needs. Jessica here again. This is our SculptPod machine. This is a great machine if you are looking to do any type of skin tightening or even reduce cellulite. You just crawl inside and you're in here for a total of 15 minutes. But previous to getting in, you are going to rub a cellulite cream all over your body. So that's going to help with the reduction of cellulite. So if you are looking for another option to weight loss, please stop on into Infinity and try our SculptPod. Being diagnosed with a scary sounding disease can be frightening. Imagine what it's like for your child. There are over 7,000 rare diseases around the world affecting children. Join me, Jessica Hatch, along with leading experts to help break down medical lingo, explain why and what their little bodies are feeling. Real faces, real stories, and expert advice. And you can watch us on the biggest South Asian TV network in North America, NTV Houston. Hi, Jessica Hatch here with Infinity. One of the things that we offer is interventional pain management. So I'm going to show you our pain suite so you can be more familiar with these services. Follow me. We have our C-arm, where we are able to do interventional pain procedures that would include the spine as well as any joint injections that you may need. So if you are in pain, please come visit us so we can take care of it. I love being able to use this repair moisturizer. It even includes retinol. And the last cool product I love to finish with is the Glow Serum. When I'm sore after a tough workout, the Muscle and Joint Body Cream by Cool CBD gives me all the relief I need. Hi, Jessica here. We are in our sleep center on the second floor of Infinity, and I wanted to show you a little bit about what we have here and what to expect when you come and have a sleep study. We have a lovely setup here for you so you can feel comfortable and feel right at home. Our technician will walk you up and he will connect you to all of the electrodes so that he is able to get the correct diagnosis while you sleep. So if you are having any sleep problems, please come visit us at Infinity so we can help you and put you on a pathway to better sleep. Welcome back from the break. We are joined by Hank and Amanda, and we're talking about hemophilia A. And so I just wanted to get back with you guys. So we were talking about the bruising right before we took a commercial break, and you were saying you don't bruise as often, but you still will bruise, more commonly than other children of your age. So tell me about that. Is any little bump cause a bruise, or do sometimes you don't even realize what caused it?
So the way that the medication works for hemophilia, you kind of equate it to a gas tank. So when you give them the medication or you fill up your gas tank, you're at 100%. And then as time goes on, until the next time you fill up your gas tank, you'll be at varying levels of, factor or gas. So
every day it goes in half. It cuts in half. After the first day, half of the medicine or factor would have been used.
And you take it every other day?
Yeah, every other day.
Okay.
Except on the weekend we take a break for 2 days.
And how does it make you feel? Sorry, go ahead, Amanda.
I was just going to say, on days that he does not get the factor that day, his levels might be low. And so if he were to run into something, bang his leg on something, he might get a bigger bruise at that point.
I see. Okay. It's more, prominent based on the medicine not being, accumulatively in there as much as it is on day one. Makes a lot of sense. So, Hank, tell me a little bit about school and kind of everything going on. I know, are you able to attend your school right now, or they still have you guys out due to COVID?
I am doing, in our school district, they are saying you can choose if you want to go in person or virtual. I'm going virtual because, with regular people that do have clotting factors, in some cases there's severe clotting, blood clot, big blood clots and blood problems if you have COVID. So we are just taking extra precautions.
Oh, you're right. Yeah, that's a very good point you're making, Mr. Hank, 9-year-old.
Because I have hemophilia, so we don't know how that would turn out.
Yeah.
Okay.
We're just being extra cautious right now. Yeah.
I can understand. So before all of this took place, early on this year, before COVID, what was a day in school like? Is it anything different from, your fellow students?
Well, usually, at least once a week, a regular student would visit the monkey bars at our school and just do some monkey bar stuff. I'm not very athletic, but if I was interested in monkey bars, my mom would not allow me to go on the monkey bars unless I'm just climbing up a ladder to sit on a higher place, because I might fall and just break something, and then there would be a bunch of bleeding.
I see. So he
cannot do any contact sports.
That was going to lead me, to that question.
I've always hated football, so.
What was that, Hank?
Good thing I've always hated football, because I'm never going to be allowed to play football anyway.
There's something I know. I wanted to actually ask you. It's something I always like to know from the interviews I do with you kids. Like, what is it that you would love to be when you grow up?
Oh, I would really like to be like a big scientist and like maybe discover a new element or something. I just want to be like a lead scientist.
I can see that you are very intellectual in the way that you communicate. So that's a big sign that you're probably gonna, not probably, you will be just that if you keep your mind at it, for sure. So Amanda, tell me a little bit about the doctor's appointments. Is there a regular appointment that you guys have to have aside from the medication that he's prescribed each and every month?
Yeah, so for him, due to the fact that he had an inhibitor, which is now what they consider tolerized, he has to go twice a year to see his hematologist. Okay. But one of those times that he goes, one time a year, he has to do what's called a comprehensive visit. And at those visits,
we have blood tests just to see that the inhibitor is still tolerized.
Yes, we have blood tests. We have to see the nurse, the doctor, a physical therapist who checks all of his joints, a social worker, and a genetic counselor. So, the social worker and the genetic counselor kind of work together to teach him about his diagnosis and ask any questions that he might have about just growing up with this disorder.
And that's 2 times a year that you guys make that visit?
Yeah, 2 times a year.
Okay.
2 times a year.
Yeah.
So within any of those, over the last 2 visits each year, has there been a time where, based on the blood work, that the inhibitors are not working properly and you have to increase the dosage, or have you been able to kind of maintain that same dosage year after year?
So the inhibitor is gone at this point, and
it's probably never coming back.
Yeah, we hope not.
At the point that it's going right now, I haven't had an inhibitor since I was 2.
Since about 3. Since you were about 3, you haven't had the inhibitor anymore.
So it's called the Y. What is exactly called the actual medication now that he's taking?
Factor.
Factor. Okay.
Yeah.
So that's, I guess I misspoke. So the Factor, there's a certain amount that he takes, and they check that every time to make sure that his body is like receiving it properly. Is that right?
Yeah.
Yes, and so it's based on his weight. So every time we go, they weigh him to make sure that he's on the appropriate dosing.
Okay, makes sense. So it's more about that. I thought maybe their body starts to become like immune and they have to take like a larger amount, but it's not the way that this works. Doesn't sound like it.
The only way that would have to happen if there was an inhibitor, and you would have to have larger amounts.
Okay.
To do tolerance therapy.
Okay. So Hank, tell me what you're, I guess, not allowed to do as a normal 9-year-old child. I know that sports sounds like it's kind of completely off the table, at least, physical sports where you're, or maybe not all sports actually. I know some of them you're not as physical. Like, is there anything that you are able to play that you enjoy?
Oh, well, there is. I kind of enjoy golf, kind of enjoy soccer, and I love swimming. All of those are non-touch people.
Yeah,
things.
You're right.
Oh, and basketball, I think, is not completely off the table, but we'll have to do some further things into that, but I don't really like football anyway.
He is able to do everything in PE that he can, with the exception of any kind of contact.
Like dodgeball, I'm not allowed to do dodgeball.
Things like that, okay. And so you have brothers and sisters, is that right?
One brother.
One brother.
Jack. Named Jack. He's the older brother that we've been talking about.
Okay. Very good, very good. You guys plans for any more children,
Sometimes
Amanda?
I wish I had a little sister.
That's what I was we're thinking alike, Hank. I was just gonna ask Mom, is there any other kids gonna be along the way? Or you guys, no?
No, she's already.
No, we aren't. Nope.
Okay, so just Wonderful. No. And is there like organizations, because I love for the viewers to know, for example, if they have had their child diagnosed with hemophilia A or B, maybe there's information out there that they aren't aware of. Is there any, .org or companies that you guys, communicate with and kind of are constantly learning more information about the disorder?
Yeah, so we're very active there's a National Hemophilia Foundation is over the whole, United States,
Okay.
that is a hemophilia organization
My
or
mom is-
bleeding disorder foundation.
Okay.
And then around the United States, there's chapters of that organization. So we have one in our area that we are active in.
Good.
And then there's another organization that's called the Hemophilia Federation of America that is also,
HFA.
yes,
That's what it stands for.
yeah. But our local chapter is the Lone Star Bleeding Disorders Foundation.
Okay, which is
Mom's
actually,
the Preston cover.
yeah, so the Lone Star Bleeding, that's how we got connected. So that makes a lot of sense. Yeah, we've had them on the show and they were actually the ones that had provided, our team your information. So they do a great job of networking and it seems like really, helping a lot of people just in the specific chapter they're in. I'm sure even around, the country as well. So is this would you call it a rare disorder? Are you familiar with the amount of diagnosed, children or I guess even babies
It's
really?
fairly rare. I mean,
Is it?
it's not super rare. Like, it's not like hemophilia A isn't like all those super rare disorders with super long names that even I can't pronounce.
There's about, I want to say there's about 20,000 people in the U.S. living with hemophilia right
Okay.
now.
Is that
So
combined A and B?
I believe so, yes.
Okay, that's still, small numbers compared, to a lot of things for sure. Goodness, there's, over 7,000 rare diseases. Like 2 years ago, that was the stat. I need to research that again for rare disorders. So, 20,000 seems fairly low for sure. Is there anything like advice-wise, Amanda, as well as Hank, that you would give to other children or parents, living with this disorder?
Well, here's some advice for parents. We highly recommend Advait for the Factor company.
Well, you just have to, when you find out, I would just say don't get on Google and start Googling everything about it. Just
Go to Wikipedia.
I would start with just setting up a support group. Find out, your local chapter, touch with some other families. We've met several families with kids the same age as Hank that, we have been in touch with each other since, everyone's had their diagnosis. So that has helped tremendously. We have just, we also have met another family that their son is much older and he's been sort of a mentor to Hank and taught him, here's how I do my medicine on, for myself instead of someone else doing. Yeah.
Yeah. So I think, finding other families that are probably in similar positions that have done a lot of maybe the homework already or even the Lone Star, it's lonestar-bleeding-disorder.org. Is that right? Okay. Yeah.
It's the Lone Star Bleeding Disorders Foundation, but I can't remember exactly the website.
Okay. We'll
it
definitely
just
put
changed.
it. Okay. We'll definitely include it when we do our post. So that way families can reach out to them because I know that they would have a lot of guidance as it looks as though they've been helpful for you guys as well. So thank you so much for coming on and telling your story. I think that there's a lot of people out there that, could utilize this information. And, ultimately we're here to create awareness, not only for your disorder, but for many others. And maybe one day find a cure. Hank, maybe you're the one that's going to find a cure for your own disorder. So I appreciate you being...
Yeah, but I don't want to test it on myself. It might make it worse.
Oh, I appreciate you being so, open and you guys have been fabulous. So thanks again. And we'll stay in touch with y'all to see how things go.
Thank you so
Thank
much
you
for
so
having
much
us.
for having us.
Wonderful. Well, that concludes our episode of Hatching for Health, learning about hemophilia A. I definitely learned a lot today and very excited to be able to share this information with you guys that have tuned in. Thank you so much, and we will be back with you next Tuesday night at 7:30.